Hello friends, welcome to Wingsvipin. Today, we will discuss about how to use prepositions effectively in the Occupational English Test, or OET. Prepositions may seem like small, simple words, but they're incredibly important, especially in medical contexts. Using them incorrectly can lead to confusion or even serious misunderstandings, which is why mastering them is essential for clear and professional communication. First, let's quickly understand what prepositions are. They're words like in, on, at, to, and for, which help connect different parts of a sentence. They show relationships, where something is, when something happens, or why something is done. For example, when you say, the patient is admitted to the hospital, it's clear they've been taken in. But if you say, the patient was discharged from the hospital, it means they've left. That one small word, the preposition, completely changes the meaning. In medical contexts, some common prepositions include at, which is used for specific locations or points in time, like the patient is at the clinic or the appointment is at 10 a.m. In, used for enclosed spaces or time frames, like the patient is in the waiting room, or the results will be available in 24 hours. On, which is for surfaces or specific days, like the dressing is applied on the wound, or the surgery is scheduled on Monday. To, indicating direction or movement, as in the patient was referred to a specialist. For, which shows purpose or benefit, such as the medication is prescribed for managing pain. Now let's talk about some verbs that are commonly used with specific prepositions in medical communication. For example, we say, administer to, the nurse administered the medication to the patient. Refer to, the GP referred the patient to a cardiologist. Discharge from, the patient was discharged from the hospital. Complain of, the patient complained of severe abdominal pain. Admit to, the patient was admitted to the ICU with breathing difficulties. These verb preposition combinations are used frequently in OET writing and speaking, so it's important to remember them. In the writing subtest, prepositions play a crucial role in describing conditions, treatments, and timelines accurately. For instance, you might write, the patient presented with chest pain for 2 hours. Here, the preposition for clearly indicates the duration. Or, the medication should be taken for 2 weeks, not in 2 weeks, as that changes the meaning completely. Proofreading your writing is essential to ensure all prepositions are used correctly. In the speaking subtest, prepositions are just as important. Imagine you're explaining a treatment plan to a patient. You might say, take the medication with food to avoid stomach upset, or apply the cream on the affected area twice a day. These small words guide your patient's understanding, so it's vital to use them correctly. You can also use prepositional phrases to sound more formal and professional. For example, in accordance with the doctor's advice, the treatment was adjusted. With reference to your recent symptoms, further tests are recommended. I'm writing on behalf of Dr. Smith to provide an update on your condition. These phrases add clarity and precision to your communication, which is especially important in medical settings. To wrap up, prepositions are small but powerful words that make a big difference in your OET performance. Whether you're writing a letter or speaking to a patient, using prepositions correctly ensures your message is clear and professional. Keep practicing, and you'll see a big improvement in your confidence and accuracy. Now, let's practice. I'll give you a sentence with a missing preposition, and you can try to fill in the blank. 1. The nurse administered the injection the patient. 2. The surgery is scheduled Friday morning. 3. The patient was admitted the hospital with severe dehydration. 4. The medication is prescribed reducing inflammation. 5. The dressing should be applied the wound twice daily. 6. The test results will be available 48 hours. 7. The doctor referred the patient a physiotherapist. 8. The patient complained chest pain during exertion. 9. The physiotherapy sessions will be conducted the rehabilitation center. 10. The patient was discharged the hospital yesterday. Comment your answers in the comment box. Thank you for watching. All the best for your exam. Please like, share, and subscribe to Wingsvipin for videos like this.